Are you interested in a new set of teeth? There are so many options in various price ranges, but they probably all sound so similar to you. Maybe it was difficult to understand all the pros and cons of each option during the consultation with your dentist, and that may have left you even more worried. But only if there was a rewind button to understand your full mouth replacement options. We'll talk about the best, the worst, and the most cost-affordable options in your search for a new smile. With hundreds of successful implants placed, I am able to help individuals live happy lives due to the options that we provide them. And if you watch till the end of the video, you'll be able to make a more informed decision for your specific dental needs, including your own specific budget. So, hopefully you find this video. First off, the most common and most affordable replacement for missing teeth are removable dentures. However, they're far from ideal and are the least comfortable option available. As a dentist, I rarely recommend dentures to my patients. It breaks my heart when they choose this option because modern technology has advanced so much and there are simply better alternatives out there. Dentures essentially replace teeth with a plastic prosthetic, severely impacting daily life. Wearing dentures is similar to using a hook for a hand. It is a prosthetic. Both serve as substitutes but have limitations. Just as a hook lacks the function of a real hand, dentures don't fully replicate natural teeth, impacting daily activities like eating and speaking. There are numerous problems with removable dentures. Firstly, they can make enjoying your favorite foods difficult and cause discomfort while chewing. They can also block or inhibit taste, since they cover the palate, leading to a decreased quality of life for many. And with dentures, your diet will inevitably be limited. Crunchy, healthy foods like carrots and broccoli, as well as meats like chicken and steak, simply become more challenging to eat. Additionally, wearing dentures can lead to bone loss and facial changes over time, as the pressure on the gums and bones accelerates this process. Considering the long-term effects, dentures might not be the best option, especially for those concerned with maintaining a youthful appearance. But it is a non-surgical option to those who don't need any extractions or implants. However, if budget is your main concern or only a few of your teeth are missing, dentures can provide a solution. Partial dentures can also work if there are enough remaining teeth to anchor them in. But typically, younger patients with really good bone are less likely to require dentures. Alright, let's talk about the next step up from a regular denture, known as a snap-in denture or overdenture. In simple terms, this refers to dentures that attach to dental implants embedded in the gums. Typically, this involves connecting 2 or 4 implants to a denture, enabling it to securely snap in place. This option is great if you're looking for more stability than traditional dentures, but your budget doesn't stretch to the most premium option, which we'll discuss later. You see, these dentures feature these small rubber rings on the bottom, allowing them to lock into implants through mechanical retention. These rings come in different strengths that can give you more grip if you need it. This allows you to be comfortable eating tougher foods or for less frequent removal. However, sufficient bone is needed for implants to undergo this procedure. It's more commonly recommended to upgrade for lower dentures than upper dentures. Typically, the anatomy of the upper jaw provides more suction and retention due to the presence of the hard palate. But the lower jaw's anatomy causes a ton of movement that patients do not like, mainly because the main force of retention present in the upper jaw, the hard palate, is missing. And this space is taken up by the tongue, which pushes up against the denture with each word spoken and every bite taken. So for that reason, bottom dentures often feel like they're floating, leading to more patient complaints compared to top dentures. And this is why an implant overdenture is almost always recommended to patients, at least for the bottom, if they choose nothing else. And when only 2 implants are used instead of 4, you may notice a slight rocking forward and back with the denture over time. The implants in the front of the jaw preserve bone, while the areas without implants in the back continue to deteriorate. This makes the rocking worse over time. Now imagine the stability you get between a 2-wheel motorcycle and a 4-wheel sedan. Overall, overdentures aren't a perfect solution because even with strong rubber rings and 4 implants, they can still occasionally come loose while eating. And over time, the rubber rings wear down, needing frequent replacements that can cost hundreds of dollars each time. But despite these issues, many patients prefer this middle ground option over traditional removable dentures. But come on, let's be honest, many patients would rather not deal with removing their teeth or having to constantly pay for high maintenance fees. They want a natural feel and the ability to live as they did before needing dentures. So for those patients, the best option you can currently have with modern medicine in 2024 is called an all-on-4. Most implant dentists will recommend it and push expensive treatment plans onto patients due to its high cost and potential benefits. But is it truly the best choice for you? Let me explain further. But hey, if you find this content helpful, please consider giving it a thumbs up to support my small YouTube channel. Your support means a lot to me. The all-on-4 is a permanent solution that remains in your mouth. You are unable to take this thing out. Only I, as the dentist, have the ability to remove it with special tools in the office. For this option, we use the strongest material in dentistry, called zirconia. It can withstand much more pressure and force for eating, so there's less concern about teeth breaking and wearing down compared to regular dentures. If you felt this all-on-4 prosthetic in your hands, you would truly appreciate the strength and durability. It feels completely different than any other option. Since it's more of a ceramic than a plastic, we can achieve beautiful lifelike colors, shades, contours, and gloss for both the teeth and gums. This allows me to create a customized, natural smile that fits your specific facial features. It's essentially a dental bridge that spans the entire arch, mainly just teeth. And you may get a little bit of gum if you have a little bit of bone loss we need to cover. This bridge can be very aesthetically pleasing because it's made of polished zirconia, which can be glazed with shine, translucency, shade coloring, and fine details in the gums. It comes out beautiful, essentially a piece of artwork. And it's an excellent example of you get what you pay for. The beautiful thing about the all-on-4 procedure is that it allows you to get an implant denture when at times many patients don't have enough bone for an overdenture. With an overdenture, all the implants need to be straight and parallel, making it easy to take out. But the bone isn't always abundant enough to do this. However, with all-on-4, we can use angled implants to maximize the amount of bone implant contact for a stronger, more stable prosthetic, requiring less bone for a higher level of stability. However, creating it takes more time and it is pricier. But in the long run, the maintenance costs are well worth it because it's much more hygienic than snap-in dentures, which can trap lots of food underneath them. All of this sounds really amazing, except for a few things. You see, the all-on-4 procedure typically involves significant bone removal because the prosthetic or denture being screwed in is quite thick. But it's a good kind of thickness because this ensures more comfortable chewing and helps restore your quality of life you used to enjoy. However, the biggest drawback is the cost. As all premium options come with premium prices, the all-on-4 is no different. When considering the potential for a lifetime of comfortable eating and the restoration of decades worth of dental issues and trauma, it's understandable that it comes with a hefty price tag. Many dentists shy away from discussing costs, but I believe in transparency and trust with my patients. The cost can range anywhere between $20,000 to $30,000 per arch, totaling $50,000 or $60,000 to rehabilitate your entire mouth. But why does this option cost so much? Let me explain. First and foremost, the lab bill for an all-on-4 is incredibly expensive for the dentist, and that cost is passed on to the patient. Producing the polished, extra strength zirconia requires a very costly machine to custom make your new set of teeth. This machine alone can cost upwards of $50,000. Then there's the extensive education and training that a dentist surgeon like myself must undergo, which comes with a hefty price tag too. I personally had to pay over $700,000 just to become a dentist. And this cost of education is only increasing. On top of that, I had to complete numerous courses and years of dedicated studying and training in surgery to be able to offer this service. And unfortunately, the high cost of education, one way or another, gets passed down to the patient in order to pay off high loan amounts taken to be able to provide this service. Like, these aren't simple dental fillings taught in dental school. This is facial reconstruction surgery. So it's neither easy, cheap, nor very accessible to learn. Furthermore, this process isn't quick. While the surgery may be completed in a day or two, we are then forever committed to each other for the rest of our lives. Problems that arise over the course of decades with your all-on-4 are inevitable because it is a surgery and individuals can treat this new set of teeth however they decide to. So there's a possibility that problems may arise, and I must be the one to step up and take care of them. This can lead to numerous appointments and chair time devoted to each patient. Now, if a dentist is performing this procedure frequently, you can imagine how quickly appointments add up and how much chair time is used for maintenance visits. This added time must be factored into the cost of treatment. You want to go to someone you feel comfortable with, someone who you will trust will take care of any issues that may arise, because this is a very expensive procedure, I understand. I hope you make the decision not to look for the cheapest price or the most affordable country to get this work done. Time and time again, I see patients coming in who have selected the cheapest option in the world, or a country where dentistry isn't done to the highest standards as it is in America. They choose to go to clinics in countries like Colombia, Guatemala, or Mexico for treatment. Then they're left in a disastrous situation because they have a mouthful of failing implants. Then the clinic that did the work is now not responding to them, not giving them appointments, telling them their appointment is months away from when they need treatment. This type of care is absolutely appalling. And you should know that if you ever go to a respected dentist whom you trust, this should never happen. I have performed hundreds and hundreds of implant surgeries, with patients consistently expressing their satisfaction with my transparency, care, and commitment to helping them smile once again. And I've had the privilege of witnessing the transformation of patients from diverse backgrounds who have undergone treatment with us. It's incredible to see how our work in the clinic can truly enhance their quality of life. So for those interested, I've included a link in the description below where you can schedule a virtual consultation and have any questions answered, absolutely free of charge. I provide a wide range of teeth replacement options, including the all-on-4 procedure. I'm right here in your pocket, just a few clicks away if you ever decide to reach out. I firmly believe there's a huge lack of awareness about the valuable services dentists offer patients in need. Unfortunately, some dentists may attempt to take advantage of patients by overcharging or recommending unnecessary treatments. So it's crucial to make an informed decision for yourself. But I'm curious to know how your experience has been with these tooth replacement options. Have they been good? Have they been bad? Drop a comment down below to let us know. I'm really looking forward to connecting with you in the future. And if you found this information helpful at all, please consider clicking that like button. I'm Dr. Rana, and I'll see you in the next video.